Now in this video we're going to be talking about something that affects a surprisingly large number of men, and that's premature ejaculation. It's a topic which sometimes flies a little bit under the radar, and even though it affects as many as 25% of men at some point in their life, it's often a feeling that people think, well, it must be just them. Alright, so what are we actually talking about? In terms of defining premature ejaculation, essentially it is a subjective call, which is where people are ejaculating within generally less than 2 minutes of intercourse, so entrance into the vagina. Now, it's not generally defined or regarded as a problem unless it's causing distress or problems to either the man or his partner. So there it is, quite a subjective call. There's primary and secondary premature ejaculation. Primary is where it's been going pretty much since the beginning of sexual activity. Secondary is where it started at some point after there's been commencement of sexual activity. So things might have been going quite smoothly for a while, and then premature ejaculation occurs. Nobody seems to really quite know why it occurs. In virtually all men there's no particular physical abnormality, although of course it can be associated with other erectile issues and sometimes can be associated with certain underlying diseases. But the main primary and even secondary forms, nobody really seems to quite know. There are fairly strong psychological issues with it, and often it becomes a little bit self-propelling, that where there are circumstances where there has been premature ejaculation, that can become a worry, and that of itself will sometimes propel it. Okay, so first and foremost, it is important for men to know, and their partners, that number one, they're not alone. That of itself may not make it any better, but it also means that it's not just you. There is help at hand. Sometimes just talking about the problem, even just in the first instance with your partner, sometimes takes lots of the pressure off the man, and that's quite important too. Right, and going along and seeing your doctor about this, again, there are some fairly simple basic ways that can be approached, and again, sometimes just being aware of the problem, addressing it and de-stressing can be a very big first step. Use of condoms, very simple, and sometimes should be used anyway, can sometimes help because it reduces the sensation on the head of the penis. So that's a very simple approach. There are some topical anaesthetic gels that are sometimes used, again, to reduce the sensation, and a lot of people find these helpful. There are other psychological type measures, and sometimes talking to a counsellor or your GP or a psychologist, sometimes overcoming some perhaps some mental blocks or issues that people may have around sexual activity in general. So that's a line to proceed down for some people. There are also medications that are sometimes used. Now, I must say there are no specific medications or drugs on the market to treat premature ejaculation, but there are a few classes of medications that are sometimes used and can have a beneficial effect. But please, they are not the first thing to use, and they're not always going to work in all people. So medication not always a big part of the treatment, but can be used in some circumstances. Now, there are a lot of claims made in the media and a lot of claims on the internet about cures for premature ejaculation. Just need to be very, very careful. A lot of these claims are somewhat inflated and sometimes involve you spending significant amounts of money to buy products that may or may not do anything. So if somebody's offering a miracle cure for premature ejaculation, you probably want to be declining that. So to look to summarise this, first and foremost, it is a common occurrence. It will happen to a large number of men at some point in their lives, and particularly if people have had a few too many to drink, if you're a little bit stressed, other things like that, it can occur. It's a little bit like having a bad day at the office, or perhaps getting out for a duck if you're playing cricket. It may happen at some point. For those where it happens in an ongoing basis, there are some simple ways of looking to approach it, and of course, like with most things to do with the body, step number one is to acknowledge that there is an issue, and then perhaps to seek out some assistance so you're back on your way to doing things the way you'd like to.